Thank you, Mr. Chair. And I wanted to turn to PFAS. I find it frustrating that PFAS comes up so often. It's such an extensive family of chemicals, and we keep hearing how it has significant impacts on human health, but it's kind of everywhere. And I think about just simple things like, does a frying pan with that nonstick surface have PFAS, and should I still be using it? And does the very, I do not recommend this, but nightly microwaving of frozen dinners, are they is the container they're in sprayed with PFAS, and should I be eating that? So I wanted to ask Dr. Woodruff, and I want to note that the MAHA report calls out the fact that, quote, the PFAS industry focused on suppressing unfavorable research and distorting public discourse, delaying public awareness of its dangers. Is this something we should be able to tackle, at least for people to know where it is? And if it's having that much impact on human health, how we can eliminate it from things that have that direct contact with humans through our food and our packaging and so forth?
Right, so you were right, PFAS, they're everywhere. They're persistent chemicals. They're measured in everyone around the globe, and we know that they can increase the risk of numerous health impacts, including cardiovascular impacts, certain cancers, increased low birth weight, which can increase the risk of infant mortality, make it that you're less responsive to vaccines. And so so your point is very well taken. We're not talking that there's a lot of uses of PFAS that we don't need to have PFAS, and the most effective and efficient solution is to look towards removing or banning the whole class of PFAS and to move towards substitutes that are not persistent. The report from NYU for the Institute for Policy Integrity noted that narrowly targeting regulations encourages substitutions of banned PFAS with structurally similar but unregulated compounds, meaning that you can get replacements. So it's best to address the whole class. And then I think your point about what we have found from internal industry documents, that the industry knew that PFAS was toxic in the 1970s, decades before the public knew that, including their own employees who were exposed to PFAS and gave birth to babies who had structural birth defects that they already knew were observed in animal studies. So I think the solution to this particular issue is to ensure that, of course, we don't want anyone to lie or mislead the public, and so there are some steps that can be taken to ensure that we have the highest quality science that's free from bias, including some recommendations that we've made about removing corporate influence on the science process, making sure that studies that are going to be done for the new chemicals program could be, those studies could be pre-registered so we know what the industry is going to do and then can evaluate and make sure that everything is compliant with that, and then removing financial conflicts of interest from the review bodies. And this is also recommended in the Gold Standard Science Executive Order to remove conflicts of interest and in the Make America Healthy reports.
When someone installs new carpeting and it's the stain-resistant carpeting, is that because it's treated with PFAS?
Some of them, yes.
And so if I had a grandchild, which I don't, if my
Me either.
children when they were small are crawling around before they're walking and their little nose is right on the carpet, are they consuming PFAS through the fibers like almost from the start of life?
Yeah, unfortunately, this is an area that we really need EPA to do a better job on, which is accounting for the fact that when kids are, like you have these little toddlers, they're so cute, they're crawling around, but they're also they're also lower to the ground and then putting their hands in their mouth, like to feel things out. But if there's toxic chemicals like PFAS in the carpet, or a lot of toxic chemicals love to hang out in dust, they're getting higher exposures to those chemicals that are in the carpet, in the materials, in the dust. It's been well documented that is true. We see this with flame retardant chemicals. In California, they did a study where little toddlers had the same levels of PBDE flame retardant chemicals as people who worked in occupational settings. So EPA can account for this in their in their risk evaluations. That doesn't always happen.
Thank you. And Mr. Chairman, this area of kind of the products where humans have the most exposure would be an area I'd love to work with you on.
Thank you. I will take you up on that. And from my days in the House, I remember this kind of, I'll say, argument. And I would like to also acknowledge that some of our heart valves use PFAS, for which there is no substitute, which makes it difficult if you say we're just going to attack all of PFAS. And it seems to me that somehow we've got to get a little bit more granular with this conversation and throw in, and I don't know, but there's probably some element of safety from fires and children whose lives are not lost because of the chemicals as well, and somehow factoring that in as well to these decisions. But I'll meet you on that, and we'll have that conversation. And I've also I'm going to volunteer Mr. Huntsman to come meet with us as well, and Dr. Woodruff will invite you, and Dr. Gross, and we'll bore down into some of these topics.
And I'll even loan a couple grandchildren to get Senator Merkley.
So I was actually going to try to beat you to that, because those of us with 18 or 20 know there's one or two that we'll send over there.
Send them right over.
Okay. Listen, thank you all very much. And with no further questions, I'd like to thank the witnesses and all my colleagues for your participation in today's hearing, especially my colleague, the ranking member. It's actually no small thing that he's with us today. Senators who wish to submit written questions for the record will have until 5 p.m. Thursday, November 6th, to do so. The witnesses' response to those questions are due back to the committee no later than 5 p.m. on Thursday, November the 20th, and will be submitted for the record. And with that, this hearing is adjourned.